Please interpret the EKG we just got for me.
Yeah, so the EKG came back, rate of 76, QRS complex is less than 0.12 milliseconds, PR interval is less than 0.2. There are deeply inverted T waves in V2 through V3. There's no precordial Q waves that I observed. There's preserved precordial R wave progression. All of this leading me to believe that the patient has critical ischemia in the left anterior descending artery.
Ooh, sounds bad. As a family doctor, while I love that amazing presentation, I've got about 4 things that I can do with an EKG. Nothing. I can give them a beta blocker, refer them to cardiology, or send them to the emergency department. While he identified the lesion, I really just needed to know, please send him to the emergency department. When assessing back pain, it gets very easy to get into the weeds and try to identify the specific muscle that might be involved or the specific joint or facet of the lumbar vertebra that's involved and or causing the pain. Rather, what I find more helpful is a functional assessment of the patient's movement patterns, and by adjusting how people move, we can fix the back pain, whereas knowing the specific cause of the pain tends to be a little less helpful.
So you told me what brought you in today was some back pain. Can you tell me more about that and show me where it hurts before I check your reflexes?
Oh yeah, it's been 9 out of 10 back pain, just located right, back here on the right, and just radiating all the way down my right side.
Like all good clinicians, we cringe when we hear patients describe how bad their pain is on an out of 10 scale. As a family physician, what I like to focus on is their functional status and what is this pain preventing them from doing.
So you said you have some back pain. Can you tell me a little bit more about your functional status? What is it stopping you from doing and what makes the pain better or worse?
Oh, it's been going on for years, and it stops me from doing everything. I can't chase around the little ones anymore.
So, in order to best assess your back pain and how to get you feeling better over the long term, I'd like you to show me your best, lowest, comfortablest squat, and then tell me what hurts when you do it, okay? All right, bugging you there.
Right here.
Okay, great. Well, so some things I've noticed that I think if we help to correct might help with your back pain. So once again, drop down into that squat. And so things that I'm looking for when I see somebody squat down are, how low are they going? Are they rounding or flat in their back? Where are their knees relative to their toes? How much ankle flexion are they getting? And is their weight centered on their toes, their heels, or their midfoot? So go ahead and stand up for me. So when people have tight ankles and they're not able to get their knees over their toes, we tend to collapse to the inside, and that puts a lot of pressure on the knee, and it's not great for the hip, and we'll usually end up rounding at the back as well. So for people that have tight ankles like yourself, one thing that can help a lot is if we elevate your ankles on something like a 2x4. And now as you drop down into a squat, let's see how that looks. So immediately we've got less rotation in the feet. They're almost in line with the knees. So we're moving in the right direction. Go ahead and stand up again. Now, the other thing that people will do is they'll try to drop down lower than the whole system can permit. So we only want to go as low as we can with perfect form. So one thing I want you to pay attention to this time is as you're squatting down, can you try to use your glute muscles to keep your knees rotated out in line with your toes? And you only go down as low as you can by keeping your knees in line with your feet. If you find your knees collapsing to the inside, stop at that lowest position. So there we go. He's a little higher up in the squat, but now his knees are in line with toes, and so that's going to save his ankles and knees. And so what we would want to do here is just spend a little bit of time. How long can a patient stay here comfortably? 10, 20 seconds. Go ahead and take a breath and stand up. And build up to maybe about a minute in the lowest position that you can, even if it's in 5 or 10-second increments. All right. Now, other things that we want to think about with the squat are making sure that our back isn't rounded. You did a great job there. Just for the sake of the audience, could you show us what it's like if you round your back on the way down? So, yeah, if we have bad hips or bad knees, we'll end up leaning really far forward. Before we even begin to squat, one thing we want to do is brace. And so if you can think about pulling your rib cage straight down into your pelvis, and now as I push into his obliques, if he's doing it right, I shouldn't be able to sneak my fingers in between his rib cage and his pelvis. Now, while you're doing that, can you check the distance between your chin and your sternum and the bottom of your sternum and your belly button? We don't want these distances to change. As I squat down, can I keep my back nice and straight without collapsing these distances? See what that feels like. Again, only go as low as you can, nice and comfortably. So you can see, but now he's got much better control. Other things that we can do to practice getting good squat mechanics if our ankles, hips, or just our coordination isn't ready for it is holding on to something to keep our forward momentum. So first, if you do a squat, notice where his torso is. As he squats down, he's got a lot of forward lean. Now, what happens if you hold on to this and lean back and try to keep your spine a little bit more vertical as you squat? And so notice how he's leaning a lot less forward. This can make it a lot easier on the lower back because in order to help the lower back, we need to have flexible hips. In order to have flexible hips, we need to spend quite a bit of time here in the bottom of a squat, which gets difficult if you're leaning over too far forward because that puts a lot of tension on the lower back. Instead, if we are holding on to something like a rubber band or a rope or a towel, then we can keep a more vertical posture, allowing us to spend more time at the bottom to get the changes that we need over the next couple of months to help with that back pain in the long term. The hinge, the deadlift, picking something up off the ground, also very important. So I was wondering if you would be able to pick this up and kind of tell me if anything bugs you when you do it.
Oh man, that really hurt.
Okay, why don't you go ahead and set that down and pause right at the bottom. So with a deadlift or a hinge, we want to make sure we're setting ourselves up. We want to lift with our legs and not our back. Many times when patients want to pick something up off the ground, they'll instinctively keep their knees locked and bend at the waist. So could you show me what that would be like if you were going to lift with your back? And so now, if anybody remembers freshman level physics, we've got a force cross a radius. So that's going to put even more tension on her lower back. Whereas if she's closer to the weight, so if you move your feet, there we go, and then you push your hips back, now relative to her center of mass, the radius is much shorter, putting less total tension on the spine. So when we're going to pick something up off the ground, the first thing that we want to do is where are our feet relative to the mass that we want to pick up? So you can go ahead and set that down. So other things we always want to pay attention to, as we mentioned in squatting, is our back rounded or flat. And so as you pick up the weight, you've been doing a good job, but show us the bad form again. You know, people will round at the back. Now, what would happen if you sucked your shoulder blades together? There, you see now instantly, this looks like a much stronger spine. And there's less tension on the lower back. And so we are not going to herniate a disc when we have a straight spine. Other things are, now do that hinge again, but face the camera. We always want to pay attention once again when we're hinging to knees and feet. So as you pick it up, Do her knees collapse to the inside, or is she able to keep them outside over her toes? So this time you did good because I called you out on it ahead of time, so fantastic. We can learn. As you're picking this up, we want to make sure we want to have a flat back. Many times people will have too much of an extension in the lumbar area or too rounded. So we want to keep the spine neutral. As we talked about before, go ahead and stand up. Once again, for bracing, pull your rib cage into your pelvis. Check your chin to sternum distance. Check your rib cage to belly button distance. And then now go ahead and pick up that weight without collapsing any of those distances. So we are noticing she's bringing her knees way too far forward, so she could sit a little bit further back on her heels. But there we go. She's not collapsing her spine, therefore she's going to have a better time. The basic biomechanics, or the order of which you want to do things with the deadlift, or picking something up off the ground, or the hinge at the hips, is it's a hinge at the hips. So we brace our core, remember, pulling our rib cage into our pelvis, and the first thing that you want to do is think about pushing your hips back just a little bit, and then a little bit of a gentle bend in the knee. Now, do you feel the weight loaded into your glutes and your hips? So once we've hinged at the hips, then we can lower down. Also, when we're deciding how to load our body with the weight, we can pick something up in front of us, and notice how that tends to want to lean somebody forward. They're a little bit off balance here. Whereas instead, if we picked it up like a suitcase, if we put the weight in line with the middle of our foot and our center of mass when we're standing, then we have a much more stable structure. We're less likely to fall forward and therefore less likely to put stress on the lower back. Here in America, we do a lot of sitting, which means we spend a lot of time in hip flexion. In order to have the healthiest back, we need to spend about an average of time in a neutral spine, which is going to be impossible to achieve, but we want to compensate at least a little bit for all the hours we spent with hips flexed, with a little bit of time with hips extended. So there's a couple of techniques that I can use to both assess and have patients do for a long-term treatment. So could you show us a little bit of a back extension? And you can brace, your arms against your hips for extra balance. So what I want people to focus on is, are you engaging your glutes? Because the more we squeeze our gluteus maximus, the more we protect our lumbar spine. And then can we get extension all the way through the neck, thorax, and lower back? One thing you might consider doing is a little bit of maximum pulses. So you don't want to necessarily just hang out here for 2 minutes at a time, but what would it look like if you get into that position and squeeze for a second and relax, squeeze for a second and relax? Show us that. So as she leans back, really squeeze all these muscles just for a second or two, and then relax, and then same thing, go back, big squeeze for a second or two. If this is a little bit too hard, the next thing I like to do is wall cobras. For any of us that are familiar with yoga, cobras are when you lie on the ground and kind of do a push-up to get your shoulders off the ground. Can you show us what that would look like against the wall? So step about an arm's distance away from the wall. There we go. And she's just going to let her hips sink towards the wall for a comfortable distance. Always squeezing glutes to protect the lower back. Are you getting those engaged?
Mm-hmm.
The other thing that I really want to instill is ground up connection. So the other thing I want you to think about doing is gripping the ground with your toes while you're doing that. So lean into the wall, grip the ground with your toes, squeeze your glutes, and can you feel how your back is connected to the ground through your muscular system?
Yeah.
So we want to build a connection all through the body, starting with gripping the ground. We want to make sure that we're saving our balance and not hurting ourselves. So another way to practice the extension is back against the wall. So if you start with your back against the wall and have about a foot distance from it, what I want you to do is bridge from the back of your head against the wall, gripping with your toes, pointing with your toes, and almost as if you're elevating your heels about 1 millimeter off the ground. Now, tell me what you feel in this position.
I feel like a nice stretch in my upper back and neck going all the way through my glutes down to my toes.
One might almost describe that as a bow of tension. And you can see that shape-wise, we're achieving that. When we're working on the system, a lot of the times our pieces get disconnected. And so how can we recreate a bow of tension from the ground to the point of action? In her case, toes to back of head. When we have our entire foot on the ground without engaging it, do you feel the bow?
No.
But is then grip the ground with your toes and elevate a millimeter of the heel,
Yeah.
and it feels different.
Yep.
So see if you can get your patients to engage their entire system as a bow of tension. A lot of back pain is also related to the Quadratus Lumborum. You might ask, what is that? With good cause, because after anatomy in first year, I kind of forgot about it. The Quadratus Lumborum is a muscle that connects from the top of the hip to the lowest ribs, and it controls side-to-side bending. And it sits in a sandwich between the psoas muscle, which also comes up the pelvic brim and attaches to the lumbar spine, and the paraspinal muscles on the back that run up along the spine. So you've got a sandwich of 3 different muscles with competing movements, and when the Quadratus Lumborum gets tight and sandwiched in between there, that can be a source of a lot of pain because it's not able to glide and slide past the psoas, past the erector spina, or even past the latissimus dorsi. If you wouldn't mind turning around, the lat muscle comes all the way down into the lumbar aponeurosis, which sits on top of the paraspinal muscles. And then this section over here of the lat as it comes across the lower ribs is a big point. So we've got this soft spot between the ribs and the hip crease where the psoas, Quadratus Lumborum, paraspinal muscles, and the lat all connect together. So this is a real big area that we want to focus on, and one of the best ways that we can do that is with some side bridges. So if you don't mind holding that, would you mind lying down on your side for me? How I like to start with this is feet parallel, bottom foot in front. You want a lot of friction. If you find yourself sliding, you may need to remove your socks. So go ahead and raise your hips to the sky. And as you're doing it, can you create a constant amount of tension from your elbow through your armpit and lat through your core, hip, and foot? Do you feel that bow?
Oh, yeah.
Very good. So now what I want you to do is slowly lower your hips to the ground, but don't totally lose tension, and then tell me what you feel.
Oh, there's a big stretch and a squeeze in those muscles.
Yeah, so right down here. We want to make sure that we're focusing on end range of motion, but tension in that position. We want to make this both a static and a dynamic movement for slightly different purposes. For those of us who have a hard time getting up and down from the ground, we can also do this against the wall. Very same premise. I want people to cue into the fact that we want ears over shoulders over hips, so make sure that you're bringing your hips in line between the ankles and with your shoulders good, where our hips are not back out of line. And so can you sink with your hip into the wall? There we go. And then push out from the wall, creating that constant tension from elbow to foot, using your shoulder and your hip flexors, or IT band, and then sink back into the wall and feel that stretch. Can you find that stretch in your side without losing tension? This is not a passive position. So once again, if we can't get down onto the floor, or if we just don't like our carpeting, we can always use the wall. Sometimes we are in so much pain that we're not quite ready to do dynamic movements. But we want to do some offset suitcase carries. We do a lot of movement symmetric bilaterally, but that means one side of our body can compensate for the other. So I'm a big fan of suitcase carries, and it doesn't even have to be a large amount of weight. And so holding something like a suitcase just at your side, again, bracing your core, and just doing some gentle marching in place. Just high knees, nice and easy. We're not going for speed. We're not going for intensity. By having something pull him off axis, you really have to engage the Quadratus Lumborum on both sides of the body, especially as we stand on one foot. The other major movement that we do that can help with back pain or hurt our back is the lunge. Amelia, could you just demonstrate a lunge for us? So she's doing what's called a 90-90 lunge because her hips and her knees are both at 90 degrees. But what this is missing is hip extension. If you'll see her back leg one more time is in line with her shoulder and her hip, we're not getting any work on our psoas muscle. So what if instead we do a straight leg lunge where you keep that back quad engaged and keep that leg as straight as possible? So things I want you to keep in mind. We're trying to get the knee in front of the toes, but in line with the foot. The goal, and we may not even get close, but what I want you to aim for is, can you bring your hips close to your ankle and your calf while keeping your shoulders upright? This is tough on the mat. She's doing great with balance. But this gets a little bit easier the more the front foot is elevated. So you can see how if she does it with her front foot elevated, she'll be able to have a little bit more balance and a little bit more depth. And then sometimes our ankle is the limiting factor. So instead, we can elevate the heel. And so again, now she can maintain an upright spine. Her core is engaged. We don't have rib flare. Her hips are very close to her ankles. Her knees are in front of toes. The thigh and knee are all in line with the foot. She has a strong back leg. And notice that the heel is straight up in the air. She doesn't have her heel cocked off to the side. Like this way. A lot of people will, sorry about that. A lot of people, if we're losing psoas flexibility, will have some external rotation of the leg. So if you could do a lunge with external rotation of the leg, meaning your feet or back foot is pointing out. So yeah, this is one of the warrior positions in yoga, but this is a sign that we're losing psoas flexibility. So as you're assessing your patients, pay attention to the degree to which they can keep their heel elevated or they have to turn their hip to an external rotation. When assessing back pain, it gets very easy to get into the weeds and try to identify the specific muscle that might be involved or the specific joint or facet of the lumbar vertebra that's involved and or causing the pain. Rather, what I find more helpful is a functional assessment of the patient's movement patterns, and by adjusting how people move, we can fix the back pain, whereas knowing the specific cause of the pain tends to be a little less helpful.